Renata D'Souza on Facebook. Be sure to tune in as we present you with updates on local activities, events, businesses, initiatives, and upcoming opportunities for all. Let's connect every Tuesday right here on Super FM and online. Don't miss it.
When considering or purchasing a new appliance, remember that we are a nation that runs on 240 volts. And appliances designed for 110 volts will need a transformer to function. Using a transformer on a 110 appliance may increase your energy consumption, and when not in use, it wastes energy and costs you more in the long term. Stylish is good for shoes, but appliances should be smart. Saving energy is what's smart.
The Forces Jacques Credit Cooperative Society Limited wishes to inform its members and the general public that its Soufrière branch will be moving to its new location on Bridge Street, the ex-FCIB building, very soon. They are looking forward to serving you in a more spacious, convenient, comfortable, and safer environment. The Forces Jacques Credit Cooperative Society Limited, saving today for a better tomorrow.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine if you're on 88.5 Super FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
Hey, we have 6 minutes after the hour of 10 o'clock. This is why we say good morning, inside this beautiful Monday. Hey, welcome inside another edition of Casualty 911. All right? If it's between the hours of 10 and, of course, 11 a.m., Casualty 911 is on. Where we speak about health issues, various different topics, okay? Hey, she's here with us this morning again. And I always like to commend her for making the extra effort. Always here to disseminate information. And along she's here with a guest this morning. So again, welcome, good morning to you, Miss Wilson.
Morning, Erlan.
Good morning.
How are you?
Not too bad, fine, thank you.
And how was the weekend, Erlan?
The weekend was, a bit loud, but like yesterday was quiet, family time, so I stayed up.
Really?
Yeah.
Wow, I thought you'd have gone by the beach or something.
Nah, most time on a Sunday, I'm always family
home?
time. Yeah, most time.
Wonderful. Well, I had a good weekend rest.
Nice.
I must admit, it was one of many.
No wonder you glowing like that, buddy.
Thank you, Erlan. Wow.
Good sleep, good sleep.
Good sleep. Good rest.
Good food.
Good food. Let me say good morning to all our listeners. It's always a privilege to be here. This morning we have an exciting topic. I know listening to our guests, reality might strike us, and it might be an eye-opener for many of us, because some of us, you know, the services are right here available. You hear persons talk about it all the time, and the best way to keep healthy, but some of us tend to ignore it and tend to do other things. But hearing it from our guest this morning, I'm sure many of you will say, oh my, you know I do this, you know I do that, you know I do this. So we're hoping that a lot of people can catch on, change their behavior, and so on. I'm not going to tell you what the topic is. I'm not going to tell you who the guest is. I'll allow my guest to introduce himself. Let me say good morning to our listeners at M&C, the market vendors, caregivers, sanitation engineers, school children that might be at home, parents at home, persons from countries. It's always a pleasure. Continue giving us feedback. We really appreciate it. Persons on Facebook, thank you so very much. Persons abroad, it's always a pleasure having you with us, and we hope this morning you can listen and learn quite a bit from our topic. So I will allow our guests, I mean, a lot of you might know him, a lot of you might have spoken to him, a lot of you might be very familiar with him, or you might just have been seeing him around and so on. So I will allow our guest to introduce himself.
Hi, good morning. Good morning, the community of Soufrière and wherever else this is being broadcast, I guess around the world. My name is Alvin Charles. I'm the pharmacist for the Soufrière region, Soufrière and environs, the Soufrière and Streisel region. I've been in this community from 2001, so I guess I'm a resident.
Very much so, Alvin. Let me just tell you, I am so happy that Alvin could come up with us because, I mean, you know, pharmacists are in short supply, and always that is a profession that we know we need to encourage our young people to go into. And the thing about Alvin, he's currently on vacation and he's taking his time to be with us today, which I am so very grateful, because knowing if he was at work, it was quite impossible for him to be there with us. So,
Yes.
many of us, we know we come to the pharmacy, we meet Alvin, and sometimes he just dispenses our medication, but there is so much more. There is so much more to it, and there is so much more you can learn from Alvin. And feel free when you meet Alvin at the pharmacy to ask your questions if you're not sure of your medication and so on. So I'll allow Alvin to start up with his topic, and persons who are out there, feel free to call. Olan, remind our listeners.
Of course, the number is 459-7885, 459-7888, or 730-538. Yes, 730-538. Cell phone.
Olan, what happened to you this morning? Repeat that again. I'm even confused.
730-538. You see, I'm trying to improvise. You know what I'm multitask.
Oh, give you that. So, Mr. Charles, I'm passing on to you.
Yeah, so good morning again. So this morning we want to discuss the whole concept of medication compliance, medication adherence, however you would want to call it. In fact, there is a differentiation which I will talk about. But let's, for now, seek medication compliance. The question is, how many of us take our medication properly? All right, and how many of us follow the doctor's instruction? How many of us stop the medication long before it is finished? You know, I know it's a problem, not just here but around the world. It is a huge problem. So this is the area we're going to talk about today: medication adherence. So today we're going to look at, we're going to define the term. We will also look at the difference between medication adherence and medication compliance. We will look at some statistics that have to do with the dangers in not adhering to the medication as you ought to take it, as well as factors that contribute to adherence and ways that we could actually improve our adherence. So it's quite a number of things we could cover today, and of course you could ask your question at any time. And the moderator will direct you. All right, so let's launch into it. According to our Pharmacy Act in St. Lucia, a drug is described as any substance or mixture of substance manufactured, sold, or represented for the use in the diagnosis, the treatment, the mitigation or prevention of any disease or disorder or abnormal physical or mental state, or even the symptoms of these things. All right, it can be used both for human and animals. A drug could also be any substance that is used for the restoration, the correction, or modification of organic function in the human body or in animal. And here's the third definition. It is any substance that is used as a disinfection of premises for which food is manufactured, prepared, or kept. Now this one is interesting because it says that if you're using a chemical to disinfect the surface that you're going to prepare food, that is considered a drug.
Really?
Yep.
Okay.
And also, well, but at the same time, it can also be a poison. So there's a differentiation between the drug and the poison. Poison is used to kill.
But you'll get to that, right?
I will hopefully.
You will get to that, to making a differentiation between the drug and the...
Yes.
Right,
yes.
cool.
Okay, so Yeah, because they are so closely related, you would recognize that a drug can be a poison as well. All right, and that's the whole concept of drug. That's the topic today for drug adherence.
That is when you over.
Yes, exactly. Or misuse it, right?
Okay, good.
Yes. Because think about it, you could take paracetamol, Panadol, and you could take it as a drug at the correct dose. But if you pop all of the bottle into your mouth, then that becomes a poison, not so?
True.
Exactly.
Yeah.
True.
And it can kill you very, very, very quickly. All right, so let's just go back through the definition. A drug is any chemical substance used in the treatment, the cure, the prevention, or mitigation, or even the diagnosis of a disease, all right? Or used otherwise to enhance the physical or mental well-being, all right? So that would be considered a drug. But however, in that definition, but what about food? But food is excluded from that definition. So food is a drug, although food can be used as a medicine, right? But it's considered in a different topic altogether. So food is intended, yes, it has function in the body and can change the structure and the function of the body, but it's a subject all by itself, all right? However, any of these chemical must be a substance that is recognized in an official pharmacopoeia, all right, which is a formulary where the world accept that this is a drug, right? So it's not just you saying, well, that's a drug. Where is it? Which official pharmacopoeia can you find it? Which official formulary? Some of the examples would be in the U.S. pharmacopoeia, which is called the USP, the British pharmacopoeia, which is the BP, or even the BNF, the British National Formulary. If you find the drug listed in one of these, and some India has their own and so forth, this will be considered a drug, but otherwise it will not be recognized as a drug. All right, so it has to comply to an official pharmacopoeia.
Okay.
Yeah. Yeah. So when we talk about the drug being a chemical, any chemical that is used for treatment, there are some drugs that are used to treat a condition. It may not necessarily cure the condition, right? So example, hypertensive drugs. How many persons are taking hypertensive drugs could say that they are cured because they're taking hypertensive drugs? No, right? Lifestyle changes, modification in your diet, and so forth can maybe reverse your condition, diabetes as well, but not because of the drug, right? So the drug treats the condition, but it does not cure it. Anti-cancer drug. And that one I put in quotation because it is intended to cure, but predominantly a lot of persons come back with the cancer comes back. So you say, did it actually cure or did it just treat the condition for a time? So this one you can put that in both categories as a cure or as just for treatment. Right? And it seemed that to the large extent it seemed to go more into the treatment category. Hypothyroidism, maybe something that you have to be on for your life, right? So it doesn't cure the problem, but it treats the problem and it can relieve the symptoms as well. But other drugs like antibiotics, for example, an antibiotic is intended to cure the problem. So it kills the pathogen, it kills the bacteria, right? And the idea is that you get cured from it. So if you have an eye infection, you don't want something just to control. Something that would, if you have an eye problem, you have glaucoma, you have, and so forth, you have an eye drop that controls the glaucoma, controls the pressure. But if you have an infection, you don't want just control, you want a cure. So these drugs, antibiotics, are used to cure. Creams can be used for that, can be used to control eczema, or it can be used to cure an infection, right? So it can go in both categories. There are other things that are used just to prevent a condition, right? And so you think of the anti-asthmatic sprays, right? The inhalers. So somebody has so you take your bronchodilator, your Ventolin inhaler, is going to relieve your distress. It's going to cause you to breathe, open your lungs and allow you to breathe. You may want to put vaccine in that category, although vaccine is a different topic, but it's also something that is used to prevent, all right? Or even do you have it, then it's going to relieve, as you know, of the COVID-19 vaccine, right? It's going to prevent you from getting a serious infection and even death. So that can come in that category, although it's a topic all by itself. And then you have other medication that is used just to mitigate a problem, like to relieve the symptoms, all right? So you have your cold medicines and you have your painkillers, you may have a headache, and the Panadol will take care of the headache, but it doesn't take care of the underlying problem of what is causing the headache.
That's true.
Right? And many times, some people say a lot of our medication are just taking care of the symptom, but not taking care of the real problem. And that is true. That is true. But honestly, if you have a headache or bellyache, at the time you're having it, you are not too careful about what is causing it. You just want relief. Afterwards, we will deal with the diagnosis and try to figure out what is causing it. But for now, I just want relief. If you're in an accident and you have a broken arm, you could care less about, how the arm got broken. You are concerned about the pain that you have, and you just want something to take care of the pain. So you have the anesthesia, or even the doctor has to make a procedure on your teeth, and they give you that anesthesia just to numb the area, right? That's all it does. It mitigates the pain, but it does not remove the teeth or remove the decay or whatever. So medication could be used for different things. As well as diagnosis, there's some stuff that eye drop the doctor could put in your eye, so that it would allow them to see what's going on inside of there. It brightens everything up, and it's like a stain or something. So medication for treatment, for cure, for prevention, for relief and mitigation, as well as for diagnosis, all of that could be the functions of medicine.
I want to ask a question. Why is it that persons get hooked on medication? When I say hooked, it's like they can't do without it. Well, something happened to them, they started using it, but for some reason they can't seem to get off it. Yeah, well,
in most instances, these medications are called psychotropic medicines that actually acts on the centers of the brain, and it actually displaces maybe your serotonin, your dopamine level, and so forth. So it acts in the brain. It crosses the blood-brain barrier and acts on these centers. It can actually alter the way that your body functions, right? It can actually cause some things like dopamine or as I said, serotonin or whatever to be released. In some instances, it can inhibit or excite. Right. So these things happen. It happens a lot with drugs, hardcore drugs. It works pretty much the same way with medication drugs. And that's why I said earlier on, you asked, what's the difference between medicine and the poison? Yeah. The same heroin, right? Or the same family that can be used as a drug by addicts can also be used in the medical field, right? For one of the strongest analgesic is morphine, right? To kill pain. To kill pain, right? And codeine and those kind of things. These are of the same class of drug with cocaine, right? And so these things can be used to numb the pain when you're making some major surgery or whatever. But take these things and you will still get addicted, just as if you were taking cocaine.
But then the doctors, they recommend just a limit amount. Yeah. Yes. And then most times they take away. For example, there are some drugs they don't allow you to go with the prescription.
Yes. So these are called controlled drugs, and it's for the same reason, because these are very dangerous drugs, and you can easily get addicted, and it can also cause deleterious harm onto your body, and sometimes irreversible too. And you would recognize early on I said that whereas a drug is any chemical, like a foreign chemical other than food. Right? So that means anything other than food that you take into your body can have will have a side effect on your body. All right? An effect, whether it is a good one or a bad one, it will have an effect, right? Food does that as well, but in a different way. Of course, if you eat too much of the good stuff, you could have food, be taking your starch and your carbohydrates, but you're eating too much at the wrong time, in the wrong portion, you will still have problems. The obesity and the hypertension, all of this like cause.
So you're simply saying do everything in moderation?
Very much so. All the bad things, completely do away with it, and only the good things, do it in moderation. Right? That is the best definition of what is called temperance, all right? Now, a drug taken into the body, there is a reaction between the body and the drug. All right? There are two areas in pharmacy called pharmacokinetics and pharmacodynamics. And the pharmacokinetics really defines the movement of the drugs in the body. All right? And the pharmacodynamic is the body's how the body's biological responses are affected by the drug. So in one instance, you could say pharmacokinetics is what the body does to the drug. When you take the drug, what does the body does to it, right? Ultimately, the body is trying to eliminate the drug, right? You take something in and let me see how fast I could get this thing out of my system, all right? And the pharmacodynamic is what the drug does to the body. So before the drug is eliminated, what effect it has on the body, right? And so when you think of pharmacokinetics, you think of the absorption of the drug, how it is absorbed, how it is taken in, how fast it is absorbed, how it is distributed in the body, whether it is concentrated in the fat, whether it goes straight into the bloodstream and begin to affect you right away. And then you think of the metabolism, how the body breaks down that drug. And in breaking down, some drugs are given as what is called prodrugs. And the body, it's allowed the body to break it down into its metabolites, smaller particles, and these are the active ingredients. Sometimes other drugs are given as active ingredients on its own, so it can start acting right away. There are some drugs, because the body affects it so badly, that it is given directly as an injection, so that it will escape the stomach. Because if it enters into the acidity in the stomach, it's just going to nullify it, right? Okay. So when you want a drug to act quickly, you try to put it straight into the bloodstream. And that's why we'll still have injections. Because if you're having pain in an accident, your leg is twisted and all this kind of that concussion, they don't give you a Panadol tablet to drink.
No
that
way.
will take how many hours to act, right? Give you straight that morphine straight into your bloodstream.
So even if the person is this person that they don't like needles, period.
Well,
they hate needles.
Exactly. But if you have pain,
phobia.
If you have the pain, I don't think you would complain. You know what? If you're really in distress, you will not complain about that injection. You will not even know when it hits you, right? You
That's
will just
true.
wonder, doctor, do something for me, right? And whatever he does. But yes, we talking about injections. I don't know anybody who really likes it. I do not know. I mean, some persons tolerate it and they right. Nobody. Whenever you see that needle, and you
syringe.
see that, and everybody says how big this thing is, right? And when they inject you, you barely even feel it. Yeah. Right?
Really? It all depends on whose hands. Some people have light and some people they like
stabbing you.
Yes, but for example, the COVID vaccine, a lot of persons are scared of the needle, right?
Yes.
And they will not go for it. But then you get that injection and you're like, you finished? In other words,
that's
I
true.
barely feel that, right?
I saw some people like that. But honestly, for me, seeing all these needles going into people, I myself get afraid of the needles too. So I develop a needlephobia because I was seeing it all the time happening to people.
Right.
And I develop a fear for needles.
Yeah, actually, I remember my brother who was into the sciences at school, and he had that phobia for blood. And his always intention was to be a doctor and whatever, but he just couldn't stand the blood thing, so he just never went into that area. He just completely blocked him out, although he did all the sciences. So pharmacokinetics, as we said, is the absorption, how the body absorbs the drug. Is it a quick absorption? Is it slow? Is it delayed? And even some of the drugs are manufactured so that you have a delay in its absorption, also a delay in its distribution in the body, right? So it can last longer. And then we talk about the elimination. And when you talk about elimination of anything from your body, you're thinking of your kidneys, right?
Yes.
So if you have kidney problems, you have end-stage kidney problem, you know the drug will stay longer in your body.
Yes.
Adults generally have poor kidney functions, and so the drug tends to stay longer in the body. And because of that, it is important that the doctor know how much of the drug to give an adult, how much of the drug to give a child, as opposed to a middle-aged person, right? Because of the conditions of the body, if they have comorbidities, and so forth. So all of these things are areas in pharmacy that is studied, so that we would ensure that the safety of the patient is paramount. All right. And of course, we talked about the pharmacodynamic is how the body acts on the body. You give the drug for a particular reason. Is it doing that, right? Or is it doing something else?
Or are you allergic to it?
Exactly, that's true. And sometimes the drug, the side effect is so much that even if the drug has some benefit, you would say the side effect is just too much. We can't. For a child, you'll not give certain drugs. You'll give the dosage and so forth because it will cause more harm than good. So there have to be a fine balance between the good of the drug and the bad of the drug.
Even if you have to cut the medication or the dosage in half?
Yes. Well, there are some drugs we could talk about which has what is called a very low therapeutic index, and we'll talk about that. And that's why it is very, very important that you measure, you know exactly how much you're giving. And that's why when you talk about drug, you talk about dosage of drugs. And these things are things that have been tested and investigated for a long time, right? To understand what is the best dosage to give for a particular condition and what is the best dosage to give for an individual who have other problems. And we talk about the kidney, and we talk about heart problems and so forth. If that drug is going to cause the pressure to go up, and the person already have high blood pressure, you know you have to either reduce the drug or use something else. So all of these are areas in medicine and pharmacy that is very important. And ultimately, it is for the safety of the patient. You don't want that the thing that you're giving the person is what's killing them.
True.
Yeah? All right. So now, I talked earlier on about medication adherence and medication compliance. The medication adherence is the extent to which patient takes medication as they are prescribed by the provider, by the healthcare provider. All right. So the doctor prescribes, take 3 times a day. How accurate do you follow that instruction? How much do you adhere to the instruction? All right. So so if you get medical advice, it may not even just be well, it may be medicine, maybe just advice that you're given of how to take certain things. How well do you follow that advice? That is medication adherence. Vis-a-vis medication compliance, it suggests that the individual is passive and that you are just being forced to take something, right? So, but ultimately with medicine, you still have something, except that you're comatose and somebody's the one making the decision for you, it's still left to you. So we could give you the best advice of how it should be taken, the best way to take it, but when you go home, it's still left to you to find out too whether you actually follow that direction. And many times it's because you don't follow the direction as prescribed that you end up into problems, all right? So yeah, so compliance, they tend to use, before they would use the word interchangeably, but now they say no, there's a little difference between the two, because one shows that you have no control. Just like somebody have a big stick and say you got to take it. Like you know, a child, the child don't want to drink that bitter pills, but the mom say you got to take it, and they threaten you, no lunch, whatever, if you don't take it. That's so you're forcing the person to comply. But adherence is you have a choice in the matter, but are you willing for your own benefit to take it as directed? All right. So, and that is that important. So when you think about it, when you think of the medication adherence, you think of two time series. Time, the time taken versus the time prescribed. Are they congruent? Are they similar? Because I could tell you take it at 12 and you decide to take it at 1. That means you're non-adherent.
That's true.
Yeah? And sometimes you may take it when you remember, right? So it means that you miss a lot of your doses. And we see that all the time. If we give persons medication for 1 month, generally, and for that self-same reason to ensure that they are compliant or adherent to their medication. If you give it to them for 3 and 6 months, they could be missing doses right throughout the 6 months and you don't know. And when 8 months later they come, they tell you it just finished. But you wonder how could 6 months medication last for 8 months? Something is wrong, right? And we even give them for a month or 30 days supply and we still find that they're tripping. Now, do we completely blame the patient? I'm not sure any one of us, even the younger ones, remember to take our medication all the time, right? You have simple medication that you only have to take for 3 days and 5 days and you trip on it sometimes.
Tell me
right?
about it.
I want to ask a question. Like you mentioned, if I'm supposed to take it at 12 and I have to take it at 1, would that still have an effect on my body?
It may, if it may, because depending on the drug, most drug it does not. But if the drug has to be taken at a certain time, for example, AIDS medication, right? It has to be taken at a certain time every day, or else it does not perform what it's supposed to be doing. Okay. You think of. Let me think of a contraceptive, for example, right? If you take it an hour after you have sexual intercourse, it's not an emergency medicine. You're supposed to take it an hour before, or at least sometime before. You know, so if you're taking the medication after the time you're supposed to take, it may have an effect. Most drugs, it does not, because your body can compensate, right? The other thing we should consider with the drug is that as I said at the very beginning, the body is seeking how it can get the drug out of the system. Every drug, right? So a drug has what's called a half-life. The time it takes for the drug to be, the concentration to be broken down by half in the body. Some may be very long, some may be very, very short.
I was about to ask you how
right?
long
Exactly. So a drug like, for example, paracetamol, within 4 to 6 hours, the drug is broken down to half. Now, if it breaks down to half, does the concentration that remain in the body is enough to produce the therapeutic effect?
Does it?
Well, for Panadol,
Uh-huh.
well, it all depends on what the concentration you took.
Okay.
If you, for example, took a very low dose and it breaks down to half, then it's not going to do anything, right? But if you took the normal dose that an adult should take, within that period it should. But of course, you have to consider the pain as well, because my pain might be just a dull, not significant pain, and yours might be a broken arm, and that's significant. So, in as much as I took the dose of Panadol, but before the 4 hours I should take it, this pain is back again, because the intensity of the pain, and maybe my dose is not even, maybe I may even have to change that medication because it's just not strong enough, right? A toothache, everyone knows who have a toothache knows this thing is serious, right? And sometimes people tell you Panadol don't do anything for that, right? It's not because it doesn't do anything, but it's just not, the concentration is not powerful enough to actually nullify or mitigate the pain. So patients who take their medication correctly, as instructed by the health provider or the health the doctor, is said to be compliant or adherent. So you take it as should be. And those obviously who do not take it correctly are non-adherent or non-compliant, which is maybe where a lot of persons fall. Yeah.
While we're here again, I want to bring up, there's persons, especially when they like to go to a party or something happens to them,
yes.
Right time they start feeling a little, or they want to go have alcohol or whatever the case may be.
Yes.
They will quit. They'll stop the medication. After the party, they'll come back. I want you to reach out to those persons practicing.
As a matter of fact, that's one of the reasons people give why they cannot take the medicine. As I work in Casualty, I remember one day it was just before the New Year festival. And one person that we had given the medication, he came back, almost like he walked back to the pharmacy to say, I forgot to ask you, can I take this medicine with alcohol? And I said, well, you've been very honest. But most persons do not even ask you that, right? But he wanted to know if there was an effect the drug was going to have. And I said, well, ultimately the drug is given to be taken with water, not with alcohol, And there are some drugs, it does not really matter very much, but there are other drugs that it actually. So for example, you're taking even something like a simple thing like a cold medicine that have histamine inside of it, right? And you take alcohol with this, and this thing will knock you out, or at least get you drowsy.
Drowsy.
And if you're operating a vehicle or some dangerous thing, that is very. If you're just at home, you could sleep and not a problem. But if you're operating, you have to drive or you work at night or something of that sort, you'll want to avoid that.
What about antibiotics?
Antibiotics usually is not affected in that way by alcohol, right? In terms of causing drowsiness or anything of that. So it doesn't really
would it actually work? Would alcohol prevent it from working, or some sort?
There are some of the medications that yes, it's advised not to take alcohol.
If you're an antibiotic,
but for heaven's sake, we are saying that
not me, not you, but somebody out there.
Somebody. Some persons who love their alcohol, no matter what you tell them, they'll still take it. They tell you, I'm not taking this, but I'm just taking that bit, and as if there is a much difference between the alcohol level, right? But generally, we advise persons not to take medication with alcohol, because alcohol is not, it's a drug, but it's a drug that counteracts a lot of the good that you're trying to achieve.
That is what I was trying to
But
prevent.
also, Alvin, for persons that might be on medication, they know, like for example, you hypertensive, you have high blood pressure, and they ask you to take one of the tablet because you have to drink. You end up taking half of the tablet.
Yes.
I mean, these are practices you hear people say all the time.
Right.
So you're asking persons.
It's like there's a guilty conscience.
Yes.
And I'm not sure what it's going to do, so let me just be on the safe side.
Yeah.
So you do your self-diagnosis and self-medication and that kind of, and so forth, which is not good. The persons who have been trained, the pharmacists, the doctors have been trained. They have gone to school to tell you, this is safe and this is not safe, and stay within that limit. So alcohol is a big issue, and a big issue in St. Lucia as well. And beyond that, alcohol itself causes problems in the body.
Yes.
So I mean, it increases your hypertension, your diabetes. All of the functional body is affected by alcohol. So you are actually causing more harm than good. And you think for a short period of niceness or pleasure or whatever, is it worth it? Right? Is it worth it when you're damaging your kidney, your liver, and so forth? Is it worth it?
I want to ask one more question. Apart from alcohol, is there anything persons should avoid while on medication?
Well, drugs, hardcore drugs, yes. But also, there are some instructions that can be given in terms of, it might just be food. It's saying that the time
That-
that,
that-
you,
that-
yeah,
yeah, that's what I'm
exactly,
talking
the
about.
time that you're taking that medicine, you should not be consuming it with food because the food binds to the drug and prevents it from being absorbed. All right, so when you thought that you took the medication and you're supposed to get an effect, but the drug never got absorbed into your bloodstream because the food nullified or the acid in the food counteracted it or whatever. So you think of you, for example, have a stomach problem, or maybe you have gastritis or something, right? And you take some antacid, which is a base, right? To try to nullify that. But at the same time, you're drinking coffee. At the same time, you're drinking something that's acidic. You're drinking pep drinks, you know, has so much phosphoric acid and so forth inside of it. You are not helping the situation, right? You thought that because I took the Dicor or the Tums or whatever, it should be okay. But then you are affecting the problem by adding more acid into your system, right? So all of these things. And I'll tell you what, as we talk about acid, soft drinks, it's really, really acidic. For one, it has a high sugar content, but beyond that, it has a lot of acid. And parents really should not be giving that to their children. I read a study that says for every one bottle of pep drink, let's say 1 cup, if you really have a cup, you need 32 glasses of water to just neutralize that. 32 glasses to just neutralize 1 bottle of Sprite, for example, right? So how many of us drink 32 glasses of water?
Per day.
Per day, yeah. For every 1 Sprite that you take, you need 32 glasses of water just to neutralize it, right? So if you're not taking the 32 glasses, it means that acid is being built up in your system. And what does acid do? It causes your body to be acidic, which encourages the growth of cancer cells and everything of that sort. But also causes your bones to be depleted, because in your bones have calcium. And when your body has so much acid, it needs to nullify that, or else you're gonna die. So it goes into the bone and what is called demineralize the bone. It takes the calcium from it so it can neutralize. Your bone becomes brittle and so forth, and then you begin to suffer from all of these arthritis and so forth.
That's true.
You know, so all of these things, persons need to know that even the food that we eat can affect the drugs that we take, and as well can affect the body itself, even beyond the drug, whether you take drugs or not. All right. So
I want to ask another question. And while we're speaking about drugs, what about drugs in terms of storage?
yes, so that is very important. Storage is important because there are some drugs that are broken down by the high temperature. All right. Some drugs like insulin, for example, you need to keep it in the fridge because if you leave it on your table, it's going to break down. Right. And so the effect of the drugs is completely gone, nullified, right? Other drugs like the tablets, a lot of the tablets we have can stay at room temperature. And that's good. But just there are some that has to be kept in the fridge or else. For example, the vaccine we talked about.
Yeah.
The vaccine has to be kept at very, very low temperature, or else it's nothing more than saline water, right? So yeah, so that is important. And as we talk about that, this is one of the things that people talk about, the storage and even what it means when what the instruction the doctor give them or the pharmacist give them, are they following it correctly?
Even when you have children at your house too, eh?
Yes. Yeah, exactly. And some of them says keep away. In fact, all drugs that should be kept away from children. In fact, it says it on the bottle, keep away from children, right? And if it's not, we try to put the label there for you, because kids. I have a son who opens every bottle. I'm not sure how he opens it. Even the safety bottles, he's just 2.5 years. He finds a way to open it.
Yes.
And they could just pop this thing into their system and drink it, right? My mom told me when I was young, I actually did something that she still remember. I went under the bed. At that time, growing up, we used kerosene, you know, gas stoves and so forth. It was kerosene. I opened that kerosene bottle, and thank God I didn't drink it, but I rolled inside of it. I poured this thing on the floor, and I swam in this thing and everything, right? And she said when she took the smell of the kerosene, she was like thinking the worst because she thought I drank it.
Right.
I guess I was way back then. I was smart enough not to put this thing in my mouth.
You know.
Yes, but all of these things. So when someone is, let's say, someone who actively, deliberately, willfully deviate from the treatment plan, that person is said to be an intentional non-adherent. Right? I know I have to go to the function. I'm not taking that drug. right?
Oh, I'm already feeling well, so I'm not
There you
continuing
go,
the
right?
antibiotics.
But it's
Yes.
a dosage, right?
Yes,
It's a dosage. Whatever you give me is a dosage, so I have to take all. Even if I'm feeling better, I have to take all, right?
Yeah, it depends. There are some they tell you when necessary, and there are some they tell you that you must take it for the entire course of the action of the regimen, right? So, for example, an antibiotic is given for 5 to 7 days. Most times, some are just given for a single dose, maybe some for 3 days, but mainly it's for 7 days. And they tell you need to take all of that, right?
Yes.
Right. However, if you painkillers, for example, you take it when you have the pain.
Yeah.
Right? You have an asthma inhaler, you take it when you're feeling, something. So some of them are, it all depends on what is written on it, when necessary or for the full course. All right. Now, other persons may be unintentional, non-adherent because they are maybe careless or maybe they just forget. And older people are sometimes a little senile and so forth, and they can easily forget. And that's why you sometimes, in as much as we know that they are not taking it well, but you have to give them some slack. You have to be a little easy on them because trust me, when you have 7 medication to take, you can easily forget, right? Some person only have 2 and they don't remember it, much less 7.
So would a pill box come in handy?
Very important, very important. This is one of the strategies that you can use to help remember what you have to take, and even have your kids, if you don't know it, have your kids put it on or set it up for the week for you, right? So you know what time to take it. So pill box is it's a very good strategy. All right. Now, why is medication adherence something very important? Because you see, the studies actually show that on estimated half of all patients do not take their medication properly. That's 1 in 2, right? Do not take their medication. So that's a big issue worldwide. In fact, I was looking at...
When you say properly, it's like missing a dosage.
It may be just missing a dosage. It may be not taking it at all. It may be just skipping dosage, not just one, but several, right? Or maybe just not taking it at the right time, as we talked about earlier on.
Now, I brought that back up because sometimes we spoke about persons forgetting or
Yes.
not remembering. What if I remember later? Should I go ahead and say, hey, since I missed that 12 o'clock, now it's 7 o'clock, should I double it?
Yeah, that's a good one.
Should I? You understand? Because I'm trying to make. Because I'm trying to make up for the lost time. So should I double it? Is that a good way to?
No, it may not be a proper thing to do. If it's close to the time that you're supposed to take it, you just forget about it and just wait for the next time to take it, right? Doubling it may increase the side effect and may not necessarily do any better for you, all right? The idea that, well, if I have to take this thing for 7 days, if I just pop all one time, I'll get well right away. That's not good at all, right? It increases the concentration in your body and causes a lot of damage to your system, right?
And give your kidneys more work to do.
Not just kidney, and damages it as well. It destroys the kidney, destroys the organs in the body. So whereas you think that you're doing well, it is just crazy. I was looking online and I saw a little comic thing that says, in fact, one researcher was saying, my diabetic research shows that test subjects are 98% more likely to take diabetic tablet if it is coated with chocolate.
Yeah. Because diabetics really like that sweet thing.
Exactly, where they're really supposed to be avoiding it, But if you put some chocolate there, they will take it.
Yeah, because you're working in the CHAs, when they come back, you hear them with there are bags of the medication, the diabetic medication at home, and persons don't take it, but they still come for more.
And that's the other thing as well. That's just abuse of the system because diabetics get their medicine free, right? So if you don't have to pay for it, no expense is coming from your pocket, then some persons are they hoard.
Yes.
They just always want to have, but they're not using it.
They're not using
right?
it.
And sometimes when they pass away, the relative says, do y'all still need that? I found my mom in my mom's room have all of that syringes and all of this, and sometimes even the insulin, they just take. So it's not a good thing because whenever you take in more, it means that somebody else is being deprived. Right?
So Alvin, what advice do you have for these persons that do that? Because I remember the last time some of the CHs came and they had, so many bags of medication, and at them the pharmacy didn't have any.
Yeah, exactly. So there are some items we can reuse, right? And good enough for us, nowadays a lot of our medications are in blister packs. So it's not the loose tablets. If it's the loose tablets, we can, because we don't know in what condition you keep it or even how if you touch it and throw it down and put it back in, we don't know that. But if it's in the blister pack, it may be safe to reuse. And you can give it to somebody else, right? The syringes as well. you may have you may have a lot that you're not using, and that can still be used. But we have to examine it properly to see if it is in condition that in good condition enough. So when we talk about the seriousness of this problem, 125,000 in America, a study was done that showed 125,000 people die a year, every year, due to failure to take medication or taking medication improperly.
Wow.
125,000 people.
That's a
That's
lot,
almost like the St. Lucian population in just 1 year. So this is a serious problem, right? 6 out of 8 people are taking at least 1 prescription medicine. So you know there are a lot of persons taking medicine. And if so many are not, 1 in 2 are not taking it properly, that could be a really, really big problem down the line. More than 1 in 3 medicine-related hospital admission occurred due to people not properly adhering to their medication. So 1 out of 3 persons who come to hospital and are admitted is because of improper use of medicine. Imagine that. All right. So this is a big problem worldwide. All right. So you ask the question. You may ask the question: what are the consequences of non-adherence? Another big question, right? Well, it all depends on the medical condition being treated, which we talked about. Some medications are used to treat symptoms, and some are used to prevent a more serious medical event. So if it's just for symptoms and you did not take your medicine at the right time, it's maybe because you did not have pain, right? But at the same time, it may be that you had so much pain that you decided to take the entire bottle, you know, to try to nullify the pain. So it all depends on the condition, but the general idea is that you want to take it as prescribed, right, which is adherence. Non-compliance is the main reason medical therapy fail and disease worsen. Because,
that is true.
Right? And so this is a big, so if you want the treatment to actually work for you, you want to take it as directed.
Is that why they give persons stronger dosage all the time? Because they're at one level, they don't take the medication, like it gets worse, so they have to give them stronger and stronger?
Unbeknown to the doctor, thinking that you're taking your medicine properly, he thinks that you're taking it as he's given you, because he's measured it, and the pharmacy, they have put it together and tell you, well, this will be the right dose for you. For your diabetes, you take that amount of insulin and so forth. So in his mind, he's giving you the amount, but when you come to get the blood sugar done, it is way out of control. And so he's saying, well, it seems that the dose I'm giving is not strong enough. And so he increases your dose, but not knowing that you are the one who have not been taking your medicine.
Okay.
Understand me? So you are actually not helping your situation when you are not being compliant or being adherent to the schedule that you're supposed to take. All right. Now, of course, when you don't take your medicine on time, it could increase the chance of the medicine, the therapy failing, right? It would decrease your quality of life, right? The condition you're trying to control or to treat will not get better, and so it could progress into something more complicated situation. All right. So hospital readmission, right? More time waste from your work and so forth, because you have not been taking medicine on time. Also, as we talked about, the doctor may prematurely increase your drug dose, change the medicine altogether. And what he gives you is more potent. That more potent also means more side effects.
True.
Yes.
Right?
True.
More potent also means more expensive.
Yes.
Right? Because they say, I used to take that little tablet for so and so, but now they give me another tablet there and I can't afford it. Right? And they gave it to you because the one that you were taking is either not working anymore, your constitution have gotten worse, or because you have not been compliant. And so your condition have gotten worse and they have to give you something stronger.
True.
And that means more expense from your pocket. Of course, it also means a prolonged recovery time. If you're not taking the medicine, then you'll take a longer time to get better, right? And all that means loss of time at work,
Loss of income.
Your income and everything of that sort, right? Increased toxicity. Higher dose, more potent medicine means more toxic, more side effects, all right? So the risk of injury and fatal consequences is increased. Patient death, all right?
Yes.
Something that could have cured the person, something that could have prevented kidney failure, but because you were not taking it, then you progress and the person passed away, right? You know, so and then the guilt is left to you. There's something else that we call therapeutic index. And the therapeutic index of a drug, all right, is the ratio between the toxic dose and the therapeutic dose. The therapeutic dose is the dose that is given to treat the safe dose that is given to treat the condition. But that same drug, as we say, can be a poison if you take more than that is acceptable. And these are all things that have been tested over time while the drug is in development to see what is the safe dose for the drug. That minimal side effects, but it exhibits the property or the therapeutic property that you need. There are some drugs that have very low therapeutic index. So for example, if a drug have a TI, a therapeutic index of 2, it means that 1 drug is the safe dose, but 2 is the dose that is toxic, right? So that means the therapeutic index is very, very, very close. So if you are not adhering, for example, you said we missed that dose and we decided to take 2. Or you put yourself into trouble.
True.
Right? However, there are other drugs that have very, very good therapeutic. Like if it's, for example, it's 13, it means that you have to take 13 times the normal dose to get sick. Right? So a safe drug would be a drug that have a very high therapeutic index. But at the same time, there are some drugs, it is just very toxic. Digitalis, digoxin, that is needed for a cardiac failure, you know? But if you take beyond what the dose is like 0.1, 0.125, 0.125, it's something below 1 milligram because it's so toxic, right? Okay. So you think of taking 2 of that when you're supposed to only take 1, and you could get toxic. That can kill you, right? Okay. Yeah. So these are some of the things. Some of the drugs like warfarin. The blood phenol, yeah, they have to be tested all the time. Phenobarbital, that is used for epilepsy, and these epilepsy drugs have very, very low therapeutic index. So if you're not taking it as prescribed, you can easily run into a lot of problems. You think of a drug maybe that is necessary for as a hormonal contraceptive. You decided not to take it, and then you had unprotected sex. Right? What happens? You get pregnant, right? Because you missed that 1 dose.
And
right?
a lot of women speak about it.
Exactly. Whereas you might miss a dose of antihypertensive or even a lipid lowering drug, like a statin, 1 dose may not cause any problem. So yeah, so it all depends on the condition you have and what the drug is used for. The bottom line is that if you don't take your medication or you do not take them as prescribed, you cannot get you will not get the results that you hope for. All right, and it will most likely your condition will get worse, and which means more complication. Trying to reverse that, more expense, more lost time, more lost money in terms of your job and so forth. Now, the other thing we probably will want to look at now, we talked about the consequence of not taking is what are the reasons that people actually give for not taking their medicine. And during the time I've been in Soufriere, as well as I hear from some of my colleagues as we interact, in St. Lucia, and all of these I'm going to give you here are things that we see or we hear right here in St. Lucia, right? And it all has to do with either the condition, it's related to the condition of the person, it's related to the patient maybe being forgetful, whatever, the healthcare system. Man, you go to the hospital to get something done, hours you were in there, what do? You leave, right? Yeah, because and you will not go back there because it's a waste of your time, a waste of money, a waste of, and so forth. And because of that, all of this could be the reason why you are not adhering. Maybe you go to the pharmacy to get your drug and there are none, and you don't have the money to buy it in the private.
But at the private pharmacy, there's always a sign telling you have to wait for at least 15 minutes.
Yes.
So I mean, when you go to the pharmacy, expect if they have 20 people or 10 people, it's almost an hour you have to wait, depending on whether
so the idea,
they give you time.
But the idea is that when they take in your prescription. The time estimated to wait to get it prepared and to deliver is 15 minutes. But it all depends, as you said, how many persons are before you. Before you actually get to deliver your prescription, there is other time to wait.
And persons have questions too, Alvin. So if
There
you're
you
dispensing
go.
the medication to me, I'll have questions. And it's good to have a
course.
relationship with your pharmacy.
Yes, true. Yes,
It's
yes.
just not come in and take the medicine and go, and then afterwards you have so many questions
Some
in your
persons are in a
mind.
hurry. I know how to read. I know how to read, and then they go
And
they
at
go-
the end of the
yes.
day, they have side effects. They don't know what to do
Exactly.
and these things.
And sometimes they just throw the medicine away and think the doctor think that they're taking it, right? So some of the reasons persons have given, we have heard, we have tabulated from some of the things that persons are saying. Well, for one, they say the doctor or the pharmacy did not explain them how to take it properly, which is it's more the responsibility of the pharmacist than even the doctor. But it's still good to ask the doctor, what you gave me. Well, I see you're writing some here. I mean, I know I'm not a doctor, but what is it for? Even if you
Yes.
can't pronounce the name, right? But heaven forbid that you leave the pharmacy and not find out about your medicine, all right? Because after that, you're on your own, right? So at least sometimes you'll see the pharmacist and the doctor. I would call and say, Doc, I noticed that you have a certain dose here that seems to be a little high, whatever. Is that the way you want it, or is it a mistake? And sometimes it's a genuine mistake. We all are human. But there are sometimes saying, yeah, because of the condition, I increased the dose. So you at least you have a reason to tell the person why is the dose higher than his neighbor
True.
or husband or so forth, right? The patient feels better and think they don't need the medication anymore, right?
Like me, like when I start taking the medication, I feel better. I completely forget about the medication.
Exactly. The other thing,
A lot of us guilty for that, eh?
Yeah.
yes, the patient is taking alternative medicine. They went to the doctor, the alternative
The
doctor,
herbalist?
the herbalist, and they tell them, well, you don't need all of this, so they just put the prescribed medicine aside, and they want to try. I don't want to mention names, that's but they want to try somebody else's concoction, right? And you don't know that, or they didn't tell that to the doctor. So we know that in a month time you're supposed to be returning, but 2 months later we haven't seen you. And when you finally come, you say, I only took it one time, but I have free refills. Right? But I say the free refills are supposed to be taken consecutively. So if it's like free refills, within the 3 months you're supposed to have to consume it. But then you come 6 months later, oh well, I went across there, I went to St. Jude's and they gave me medicine. And what about the one that you have been taking? You did not show it to the doctor? They're just building up all these stories, right? Just to tell you that they not tell you that they have not been taking it, but they tell you that, oh well. And interestingly, the thing that's very, very interesting is that most of the medicine that we don't have, that persons have to buy in the private, they don't take it, right?
Oh.
And they would always tell you, I have it already.
Is it because of the cost?
The
Yes,
cost.
the cost.
That's exactly
Yeah,
it, right?
It's cheaper. It's cheaper.
Oh yeah, by far, because the government is subsidizing the medicine. I mean, healthcare for all, that should be the government's policy, right?
So it has to be the person's personal responsibility to have a little money aside for medication.
And it's expensive, so you want to take care of yourself so that you don't have to be on this chronic medicine, this
Yeah.
chronic, develop this chronic disease, right?
That is so true.
Right? So I guess when you're doing health education, it's all about telling a person, try to avoid having diabetes. Try to avoid, because prevention is better than cure,
Cure,
right?
very much
But if
so.
you just careless about your life and so forth, there are consequences for your pocket as well as for your health, right?
Now another thing again quickly, because I see the time.
The time is up, okay.
Up already. But I wanted to highlight, even with the herbalist, in terms of we taking medication from the herbalist, and we don't even know the dosage. We just tend to just drink it.
And for heaven's sake, you can't even pronounce the name inside there.
And some of them give you the medication and it has no name on it. And I tell them, how do you know what you're taking?
Right. So we would think that a registered alternative doctor herbalist is taking medication in proper dosage form. And sometimes it's manufactured outside of St. Lucia and they bring it in, right? But there are sometimes you just go and the person mix something in and they put some concoction together and they tell you. The bad thing with that is that you do not have a dose.
That's the thing.
You're just mixing things, right? And you don't even know if there's interaction between the things that you mix into. And the interaction could be for good or for bad. You
But
understand me?
some of them tell you continue taking your doctor's medication.
Yeah, well, which is if it does not interfere with what they're taking,
Yes.
right?
Yes.
There's sometimes some of the herbal medicine does counteract or interfere with what you're taking, or it can increase the effect. So it have a synergistic effect, but it might be too much.
Too much.
So if you're taking the two, it's good to at least consult with your doctor so he knows either to cut back his and allow you to take your herbs, or if to stop it altogether, or if the two can work synergistically, right? So all of these things are important. Yeah. So as we, I know we coming to the end, so let me just run to some of the things that you can do to improve your adherence, right? Understand the instruction before you leave the compound, the pharmacy, the doctor, wherever. You have to understand it, right? Take medication as directed. So you have to discipline yourself. Try to know your medication by name and not simply by shape and color. Oh, the little white one. All right, there's so many little white ones. I don't know what you're taking, right? Sure. So at least if you can, you try to name, have the name, write it down, try to pronounce it. What about understanding the label? So the pharmacist's responsibility is to interpret the doctor's so-called shorthand, right? So when the doctor puts something like Q8H for us, you may not understand what's Q8H, but we're supposed to understand and write it in a way that you will understand. So the legibility of the writing, right? Because sometimes if the pharmacist writes in such a way that you yourself don't understand, you could easily make a mistake, right? Even when the doctor writes in certain ways, we could call back the doctor and say, I'm having some difficulty understanding what you have there, right? True. Because you're not following any standard abbreviation. What about when the doctor say after meals? What does that mean? At what time is after meal? Is it immediately after meal? Is it 3 hours after meal? Right? So all of that you want to clarify. Does it mean that you have to have food on your stomach? Yes. But after meals could also mean I ate at 8 o'clock this morning and now it's 11 o'clock. But at that time the food is no longer on your stomach. True. So it's after meal, yes, but it's more like your stomach is empty already, right? Before meals even worse, because when you tell somebody before, oh wow, I forgot to take that tablet, I will take it and then I eat my food. So you have your breakfast here already, and then that's when you remember you have to take it before meals. And as soon as you send that tablet down, you begin to eat your food. That's defeating the purpose. Before meals means 2 to 3 hours, 2 to 3 hours before meals or after meals. So that in other words, it means an empty stomach.
Yeah, I thought was honestly. I thought was taking the tablet and then having your breakfast.
So that is we food. That is we food.
No. Well, if that's the case, many of us are ignorant about the fact.
Yeah. So
because I mean.
An hour before or 2 to 3 hours after.
Happened to me too.
Because that's what I do when I give my mom her medication. They say before meals, I give it to her and then I tell her, go and take her medication. Go and take a breakfast.
Yeah,
oh my God!
Yeah,
well,
it's not. So it's really an hour before meals or 2 to 3 hours after you eat. So in other words, the idea is
I think they need to specify that one on the
an hour before.
Yeah.
An hour or two.
And we do have auxiliary label that says take an empty stomach. And it says the hour before 2 to 3 hours after.
You must have been doing the same thing like me.
Yeah. So one person asked me once, take 1 tablet 3 times a day. Does it mean I have to cut the tablet in 3?
No.
Right? That's been too wise, right?
Yeah.
1 tablet means one in the morning, 1 in the night. Someone said 1 tablet, but you said 1 tablet 3 times, so I have to cut it in 3. This has just been crazy, all right? And when you tell somebody, keep it on the fridge. Now, we say that loosely, keep it on the fridge. What do we mean?
You see somebody might just put it on top.
Exactly. So it's really supposed to be keep in the fridge, but we sometimes say keep it on the fridge, which is not.
Somebody will actually put it on the fridge.
Somebody asked me that. Does it mean to put it on top of the fridge?
Yeah.
Oh my God.
Yeah, but I guess some people are just being facetious too. But one of the things I got when I started here was a lot of people saying, can I have a bath? Can I bathe whilst I'm taking the medicine? And I don't know why it was. So many of the older people were asking me that. May have been the culture at the time. But there's no such thing as not being able to be, except if the thing is for your skin, and as soon as you put it, you wash it up again. You know, that's not going to be helpful. But tablet taken in should have no effect upon whether you bathe or not, right?
Yeah.
Can it be taken with alcohol? Yes, pretty much you tell a person not to take tablets with alcohol. Tell your doctor, your pharmacist, all your medication that includes even your herbal ones, right? So we know that you have other things taken and where the potential side effects could be. The herbal stuff may still be considered a drug, and herbal does not always mean safe, which is what we underscore, all right? There are other things that you can do. You can ask your doctor to prescribe a simpler regimen than what you're taking. Doctor, I'm taking 6 medicines. Is there any other way that I could take less? And maybe that we have a combination tablet. So instead of it has 2 medication in. So instead of taking 2 separate ones, then you just take the one. It's easier to remember, right? Schedule the time when those should be taken. Consider all the medication, and that is very important so that you would avoid the confusion and so forth. Having the pill, having the organizer, the pill box and so forth, that is very, very helpful. Some persons have alarms, right? That tells them. Some persons sometimes you just have to set a reminder, a routine that you would do at a certain time, and then you say, whenever I go to the fridge, I remember I have to take my medicine, right? Whenever I take the dog to walk out for the night, I know that's my evening dose. So you set reminders for yourself, rituals that you could remember. When you sit down to have your meal, you say, oh yes, I need to take that medicine with my food. So these are things that you can do. Also, you can have a medication buddy. Somebody that actually from the home that is responsible for reminding you. All right. So all of these things could be things that we can do to improve our adherence to medicine. I think if we do that, we will be on the safe course. Yeah.
Yeah. I have a question, Mr. Charles. Most times, walking at the hospital, you see quite a bit of ladies coming for their medication and so on. And you don't really see the men, or maybe the ladies coming for the medication for the men and so on. I don't know, but those that coming for the medication are most likely those that actually come to visit the doctor.
Yes.
So I'm asking, do you see more women or more men, or is it a little bit equilibrium there?
St. Lucia, I'm not sure for the other Caribbean islands, but St. Lucia, women take care of their health much better than men.
Well, listen to that carefully.
All right, men, and that's why sometimes when a lady has a condition, it's usually captured early because she always visits the healthcare system, whether it's in child for the prenatal or whatever, but they capture it. And the men usually, when they discover they have cancer, it's in stage 3 and 4 already, right? Diabetes, sometimes they will tell you, but that person was well, and they just see the person run down real fast because they have that prostate for a long time. They have not been saying anything to anybody. Prostate is a really ticklish one because the digital thing is really scaring a lot of men from having to get their thing examined by the finger.
Although at our health fairs, we had one at Delcef, Fongejac, Soufre, the men's health fair, and the numbers were really high.
Well, that's good. That's a good thing.
In the 60s, the 50s.
Men coming to visit.
Men come in. Right. I think at Delcef we had 49 or 50 or even more.
And when they have these promotions, it's helpful because also the test that is done, is, you get a reduced cost on the test. When you have
they get a reduced cost. So it was really, really good.
So what next would be the next men's health?
I'm not sure. We had one at Delcef, I think this month or last month.
Yep. You had one at Eaton's recently.
They had one at Eaton's. They had one at
Yes.
Well, Erlen, yes, you knew about the one at Fongejac. I didn't see you at all. The one at Delcef, there are quite a bit of numbers. Young men, as well as the older men, but more older men came.
Right.
And I must compliment. The men for coming. And they engage in all the services that were available.
Wonderful.
So,
and of course, in our part, some of the things we do, we write a number of refills on the paper for you, so you know that you have two more times coming back or whatever. So that's helpful. We try to give 30 days, maybe up to 90 days sometimes, and not go beyond that because we want you to come back and interact with the system, right? Interact with the doctor, see if your pressure on your diabetes is still under control.
And be honest with the doctor and the pharmacist.
Yes, exactly. They tend to be more honest with the pharmacists than the doctors. I don't know why. Maybe we are nicer people.
Oh, yeah, that was easy to talk to.
Yes. Of course, if there are times that you need to provide, if the label is too long to put, we have to put a separate sheet and write it legibly so that persons can understand. All right, and just our friendliness in dispensing the relation with the persons, really answering their question, providing information, that tends to help. All right, providing adverse effect and drug interaction info as needed. All of this. So you can ask your pharmacist, you can ask your doctors, ask your the nurses sometimes are the ones doing the administration. If they have a question, they come to us. But all of us are specialists in our various fields, and the collaboration and it is very, very good for the benefit of the patient. Yeah.
Thank you, Alvin, so very much. I know time is running out on us. Oh my God. I can see, Erlan, let me see your face. But I must admit, that information was very, very important and very integral in our everyday life, especially in our family life. Erlan, since you said you're a family life man, and so make sure you know you adhere to everything when the doctor give the medication, and just don't say, Doctor, apa saya kadi? Right, my latim yet plea. You know, and all this kind of stuff. I mean, we're in the community, we're at home with our families, and sometimes the very same thing that you're saying, Alvin, is the very same thing that we do the direct opposite of. And now that we know all the consequences of on our body,
Yes.
and the financial impact, and so on our family and community at large, we want persons to, you know, be more vigilant and follow the directives as the doctor and the pharmacist have given you when taking your medication. We know it's not an easy thing, but like Alvin said, Mr. Charles said that, you know, there are different ways you can do that. You can have a buddy, you can have the organizer, and so on. And I'm really glad that he brought that up too, because I mean, and the other thing, Alvin, I must admit, sometimes we as persons who administer the medication to our parents, we need to be a little bit more educated on the medication ourselves, and so on, the way we administer it to them.
That's correct.
And because many times our parents cannot read and write, and we are the ones that administer the medication.
So accompanying them to the pharmacy, or even you yourself come in instead of them, because they may
Yeah.
not remember everything we say is important, right?
That's the thing. So make time for your elderly people, your loved ones, your family members, so you can ensure that they take the medication the best way. Again, let me say good morning to Fawn. I know you've probably been listening. Usually miss. I know Erlan miss you dearly because you haven't seen my face for too long. Let me say, Mr. Charles, again, thank you so very much. I know I've taken the day of your vacation day, but I feel that it was quite important that you
like
come,
true.
because I've been begging you for
Yes,
maybe
yes.
2 years now.
Yes,
And I'm really, really
I
grateful.
guess I owe you this one.
Yes, you owed me that one. Thank you again so very much, and continue providing the service that you do. I know you go way beyond, because at times at Etangs and other health centers, you're there very late administering medication. A lot of people don't recognize when you go the extra mile. So I am really, really happy that you go the extra mile for our community. And again, thank you so very much.
Right. And remember, before meals is 1 hour before, or
Oh,
2 to
yes.
3 hours after.
Thank you so very much for the reminder.
Yep.
All right.
Anyway,
Ulan,
till next time, guys. That concludes Casualty 911. All right.
thank you, Ulan.
Bye-bye. Have a good one.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Sufra FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?